Stacey is a nationally certified traumatologist, registered psychotherapist, and master practitioner in clinical counselling and with the Canadian Professional Counsellors Association. She currently leads the Psychological Services Division as manager at the Calgary Police Service in Alberta, Canada. To speak on the police psychological support model, please welcome Stacey Ferland.
My name's Stacey Ferland. I'm the manager of Psychological Services Division with the Calgary Police Service, which is a large police force in Calgary. And it's my honor today to introduce you to a progressive, innovative, new way of delivering mental health supports to police officers in North America. I think it's important that when I'm explaining what we do for psychological services for our sworn members in CPS, Calgary Police Service, I do want to just present a little bit of context to the history of Calgary Police Service. So it was established in 1885, and the first chief of police, his name was Jack Ingram. Not only was he the first chief for Calgary Police Service, but he was the only police officer. So the only police officer for a population of 14,000 people. And his role and responsibility was primarily giving out fines for people that were riding their horses too fast and arresting people with drunk and disorderly behavior, and then helping out the local fire service. Today, we have just less than 3,000 employees with the Calgary Police Service. We have one chief, Chief Neufeld, and then he oversees 4 bureaus. So just to give a little bit of context to the structure and the governance of CPS, we have 4 bureaus. One is Bureau of Corporate Support. Another bureau is Bureau of Operations. We have a Bureau of Community Services and a Bureau of Investigative Supports. The Psychological Services Division, which I lead, is within the Bureau of Corporate Support, and we're headed up by one of our deputies. And so this bureau is the bureau for the people. It's the bureau for the employees. So we have information technology in that bureau, we have fleet and facilities, we have professional standards where, unfortunately, we have to investigate our own officers. We have the Chief Crowfoot Learning Center, which is the equivalent to a recruit training academy. And then we've got Respect in the Workplace, and then the Psychological Services Division. So this is the organizational chart for the actual division. So there's myself, and I'm the 4th manager since 1978. And if you think back to 1978, not only were we not talking about mental health or counseling or psychiatry, we definitely were not talking about mental health with police officers in 1978. And so that first manager, who was the chief psychologist and only psychologist in Calgary Police Service, never saw anyone. They had an office in human resources, and nobody would go see them. And actually, the legacy still stands to today, where police officers actually referred to the psychologist as Dr. Bonkers. And if you were going to see Dr. Bonkers, you were crazy, mad, and insane. And so police officers in the 70s and the 80s didn't go to psychologists. In the 80s and 90s, there was a shift, and the psychologist at that time didn't see any police officers. Police officers didn't come forward in the 80s or 90s either, but their wives did. Their spouses were going for therapy, and they were reaching out for support and asking the psychologists to help them with the members, because they were noticing that members were starting to struggle. So in terms of the actual makeup of the in-house division, we're the first of its kind in Canada, and we're the largest. So we have myself, we have 5 internal clinicians, 2 of which are psychologists, 3 are social workers, all MSWs. I have a team of 3 administrative support staff. And then in the community, and this number is rising since I developed this slide, we have over 200 service providers in the community. And those service providers have contracts with Calgary Police Service, and they range from couples and relationship counselors, family therapists, yoga instructors, individual therapists, teachers, and then psychiatry. To get in to see a psychiatrist in Alberta, the wait can be anywhere from 12 to 18 months. With having our own 2 internal psychiatrists, we can have our employees seen within 4 to 6 weeks. So we're very fortunate with the current internal infrastructure that we have in the division. So just to recap here, so we're established in 1978. We are modeled off of the Los Angeles Behavioral Sciences Unit. So I will consult quite frequently with my counterpart in Los Angeles because we try and keep up with best practice and ensure that all the services that we're delivering are evidence-based and that they're really in alignment with our partners in Los Angeles. Confidentiality and privacy is, I can't speak enough about it. Because we are part of the organization, our clients are also our colleagues. And so to not compromise trust and to maintain privacy and confidentiality, it's a very tricky, complicated dynamic that myself and my team that we have with our colleagues who are our clients. And I'll talk a little bit more about that later. So within the division, there's 3 pillars. There's 3 distinct pillars. One is the employee and family services. So that's all the things like assessment, diagnostic evaluation, treatment, counseling, family therapy. And we don't only see sworn members, but we also treat civilian members and all their families. So yesterday we heard a lot about limited supports for family members. And I can say that on behalf of Calgary Police Service, we strongly recognize the impact that policing has on our family members. And so family members can reach out for any support through CPS Psych Services, and their issue doesn't have to be related to CPS, policing, or their spouse. The second pillar is industrial organizational services. And so what we're doing there are things like critical incident debriefs. So after any major critical event, we will offer a critical incident debrief. And I'll talk a little bit more about what that looks like shortly. We also provide fitness for duty assessments. So for any officer that's been absent from work, whether it be disability, workers' compensation, or they've been just on secondment somewhere, we do offer fitness for duty. If an officer has been involved in a shooting, the fitness for duty is a mandatory component of psych services, and it's the only mandatory component that we have in psych services. The rest, it's all voluntary, and people will reach out for support on their own volition. They're not mandated or forced to come. We also run a number of workshops, wellness courses from resiliency training, mindfulness training, depression management, conflict management, relationship building, post-traumatic growth, moral injury. We have a kind of a menu of different courses that we run throughout the year. And many of those courses are offered to recruits before they get even in the field. We also have what's called the Safeguard Program, which I'm going to talk about shortly. And again, that's kind of under the organizational services. And then the third pillar is forensic. So Dr. Bailey, who's our consultant forensic psychologist, we're very fortunate to have him because he's also a lawyer. So we've got kind of double the expertise with him. And so he will be available to provide consultation to officers when we have unfortunate events where there's hostage negotiations or there's some support around forensic profiling. We can tap into Dr. Bailey's skill set. So just to summarize here, again, this is the employee and family services are all the counseling and the therapy that we provide. For those of you that were in the ART training yesterday, we have all our staff are ART trained, EMDR trained, PE, CBT, CPT. We do see children. So we see children of sworn and civilian members. So we do have play therapy, and we also have sound trade therapy. We are a 24-hour, 7-day-a-week service. So psych services never closes. That's probably why some of my staff are looking at me now thinking, wow, you've aged in the last couple of years. I am on call 24 hours, and there's always another member of staff that are on call. And I will continue to advocate for my people, my officers, because crises and critical events don't generally happen between 9 to 5. They happen during the middle of the night. And that is so important that our officers have somebody that they can call for support, guidance, advice at any time of day. We also offer very specialized couples and family therapy from Imago, Gottman method, and then emotion-focused therapy. So I just want to kind of touch on 3 very distinct components of the organizational development pillar. So the critical incident debriefs that we offer, these are not operational. They're not tactical debriefs. These are emotional debriefs that allow the officers to come together. They're not in uniform. We usually run critical incident debriefs after the shift ends or sometimes on a weekend, and we co-facilitate with the peer support coordinators. It's not CISM. We don't support the CISM model. What we're doing in the critical incident debriefs is we're allowing an opportunity for officers to come together and support each other vicariously, learn about the normal responses to trauma and tragedy and crisis, and then have an opportunity to look at how do they access resources, supports, and we make ourselves available. Sometimes people don't, they've not been to psych services, so again, it's an opportunity to talk about what is available. And the sense that we're in this together is really what sits center stage for our critical incident debriefs. We do bring in our CPS trauma dogs, so we have 3, Weber, Callie, and Hawk, and they often accompany us to the debriefs. And this is Hawk, who is our oldest CPS officer dog. The other thing about critical incident debriefs that might be unique to other policing agencies is we offer the critical incident debrief to the families. So not only are we focused on the officers that have either attended a difficult call or perhaps their peers who weren't even on shift can attend a critical incident debrief, but we then also offer a critical incident debrief for the family members, and only the family members can attend that. And again, that's to ensure that the family members are getting the resources, the supports, and that they're recognizing that not only is the critical incident impacting their spouse, but it has an impact on them and their home life. The Safeguard Program. So the Safeguard Program, it grew out of the FBI, and it was originally designed for officers that were in specialty units, so undercover, homicide, child abuse, guns and gangs, drugs. What we've done since I started with Calgary Police Service is I've realized that population, although they're under high levels of stress, and being undercover certainly impacts home life and can certainly disrupt identity and how one views the world. But what I recognized is the officers that are on patrol and all the other areas need the Safeguard Program just as much as the specialty areas. And so we've opened up our Safeguard Program to all sworn members, and then I went one step further and I offered it out to all civilians. While we don't see as many civilian employees for therapy as we do sworn members, the civilian members actually report high levels of distress, which we find very, very interesting. So this Safeguard Program is a once-a-year health check. It's an opportunity for a member of an employee to come in, meet a member of staff at psych services, do a check-in, and we normalize it. We view it as it's no different to going to see your dentist or having your vision checked. It's just an annual check to just make sure that one's resiliency is intact, that their supports are available, and hopefully provide early intervention if somebody is struggling and hasn't come forward before the health check. The Reintegration Program, this is a brand new program that we're just starting. So this is designed for officers that have been absent from work, or they've been involved in an officer-involved shooting. So after any officer-involved shooting, the officer is mandated off 30 days. And within those 30 days, part of that is to decompress and be with family. But also we want to start the reintegration process quickly and get them back to work and get them back functioning if there's been some compromise. So the Reintegration Program, it's a very unique program where the officer will come in, meet a clinician. They will use either ART protocol or the recent events protocol from EMDR. They'll process through the scene, so if it was a shooting or a critical event, they process through the scene, and then a police officer who we've had prolonged exposure trained would go on to do the in vivo exposure with the officer. So if going back to the range and working with their firearm is something of, it's triggering, the reintegration officer supports the exposure. So we don't have any outcomes because we haven't started this yet, but I'm hoping in the next 2-3 years we'll have some significant outcomes to show the effectiveness of actually having this very unique. The psychologist role, I've mentioned some of this already, but they do have a background in forensic psychology. They do all the pre-employment psychological testing, so we're screening candidates who are applying to become police officers. We're screening them and we're using the MMPI, the 16PF and the INWOLD. Dr. Bailey, as the psychologist, is the only member of our staff that can complete fitness for duty assessments. We do respond to officer-involved shootings or critical events in the middle of the night. And what I mean by that is myself and another clinician, we actually go to the scene, and depending if it's an officer-involved shooting, the subject officer who discharged their firearm is not allowed to be with the witness officers. And so the two clinicians will separate and will provide support to those members right there and then. And then we do have, this is Jaden, who's got the funkiest of hairstyles. So he is our in-house emotional support dog, and he actually is not very well trained. He's not well trained like the rest of the dogs here, but the officers really respond to him because he just kind of runs the place, and they tolerate him really well. So just a little bit about our stats. So remember, go back, 1978, one psychologist, nobody saw them. These are the stats from last year. We have 2,943 employees, sworn and civilian, and we served 1,749 individuals in psych services last year. I look at this number, and sometimes people ask me, well, what's going on? Like, why are all your employees of Calgary Police Service so unwell? And I say, no, they're not unwell. We've just reduced stigma. People are coming forward. They're asking for help. The other part of this, again, when you look at the numbers, is the vast array of services that we provide. We don't just provide mental health. We also provide support for learning disabilities. So any officer or civilian's child who is diagnosed with a learning disability, we will provide the psychoeducational assessments, and we have multiple special needs teachers that contract with psych services so that we can take that stress from our officers and help the children get some support with their learning difficulties. Sometimes I'm asked, why do you do so much for families, and psychological services and CPS is not responsible for families' mental health? And I go back and I say, yes, we are responsible because we need our officers to show up to work with the least amount of stress. They need to be able to function operationally, do the best they can in high stressful situations. And if their family members are suffering and unwell, they're bringing that to the work, and that can certainly have an impact on their ability to do their job to the best of their ability. So we take care of their families as much as we can. Very quickly, again, the systemic considerations. I think this is it's the biggest challenge for an in-house psych service with a police force, because we're not external to the organization, we're internal. And so we're constantly balancing this very dynamic, tight relationship and ensuring that we don't slip up. So what I mean by that is we can be in a business meeting or a strategic planning meeting at 10 a.m. and 11 a.m. that person that we've just been in a meeting with is now in our office, and so our role changes. And this is very, very tricky when you've got chain of command. So a high-ranking officer could be in a meeting with myself saying, I need you to do this and this and this, and then the roles are reversed in the next hour. And so we really navigate, and we do an awesome job, both the officers, the clients, and then ourselves. We do a great job at trying to maintain that balance. But I do have to say that as a trauma therapist, I've learned so much about compartmentalization with my clients, and I have to say that compartmentalization works really well as a therapist when you're working in an organization where you're treating your own colleagues. Just the clinic environment, because of privacy, we are an anonymous location. We're off-site. We're not attached to any district office. We're not attached to human resources, which is sometimes a concern. We are patrolled by security, and it is locked. It's locked for a couple of reasons. One is we don't want the general population, general public coming in. We also have officers that are undercover. And so again, we want to protect their anonymity and their privacy. We're also in a location it's downtown Calgary, so we're obviously aware of the clientele that is around the area. The other reason for it being locked is we stagger the client's appointments so that they're not kind of bumping into one another. So each clinician has their own waiting room, and then because we're locked, we can just ensure that any clients that are leaving the office are leaving from the back door as the new clients are coming in through the front door. And that's really important, and the officers really trust our process around that. So that's why it's locked. Again, the appointments are staggered just to ensure that discretion and privacy for people. We have a very lovely location. It doesn't look like the rest of Calgary Police Service. It's bright, there's lots of windows, it's non-clinical, and the officers they love the space. And this is what it looks like from the outside. And I have 1 minute left to go. So I'm considering it took me 40 minutes when I was rehearsing. Thank you so much.